Good to have you, Jessica. Thank you for joining. Pauline, great to meet you. I will go ahead and introduce myself while we still have some people coming in. I'm Kelsey Knowles. I'm the Director of State Engagement for Atlas and leading the implementation of Atlas in the state of Wisconsin. So a little about my background. I'm a person in long-term recovery, recently celebrated 10 years in recovery, which was really exciting. I've worked in the field of mental health and substance use almost as long, in multiple capacities, as a peer, as a supervisor of peers, doing technical assistance, as a therapist for a little while in a detox facility. So I'm pretty familiar with the substance use systems, both from the provider side and also as a person receiving services, and really excited to have joined the Atlas team last year and be able to tell you about the really cool work we're doing. Shannon, welcome. Thank you for joining. I am going to go ahead and share my screen. And Catherine, do you want to introduce yourself?
Hi, everyone. I'm Catherine Taylor. I'm a program coordinator with Atlas, and I work closely with Kelsey. So welcome and thanks for attending.
Thanks, Catherine. So I'm your main point of contact for Wisconsin, but Catherine is absolutely amazing. So organized, it is crazy impressive. So if you do run into any technical issues providing data for Atlas, Catherine may very well be the one to help you out. So I'll sort of start at the beginning. Shatterproof is a nationwide nonprofit, and Atlas is one of the key pillars of the work that Shatterproof is doing. So the other areas that Shatterproof does work in is around stigma. Again, that's nationwide. They do really cool stuff like walks all around the country. They also have an educational series where they go into, say, a large employer and provide education around how to help folks with substance use issues, stuff like that, how to recognize that. And then we have sort of our advocacy arm, and they work at both the state and federal level to move forward legislation that is favorable for folks living with substance use conditions. Most recently, they had a big success with the MATE Act getting passed, which is going to expand access to medication-assisted recovery. So Shatterproof's doing really cool work. My role is really focused on Atlas. That's what we'll focus on today, but just kind of wanted to give you the big picture of what Shatterproof is in case you had not heard of us before. So I'm going to talk a lot about Atlas being data-driven and quality-driven in this presentation. And when I talk about quality and data, all of that data is linking back to these national principles of care. So this is a really good kind of foundation to set, just so we're all on the same page in those conversations. So Shatterproof created these national principles of care as a collaborative effort. It started with a 2016 Surgeon General's report, and from there, Shatterproof convened a team of national experts to really drill down the information in that Surgeon General's report into these 8 salient points. So when a treatment facility provides data to Atlas through our Atlas survey, those questions are all linking back to these points here. The only exception is number 1, because that sort of happens outside of the substance use treatment system. That'll happen kind of beforehand. But all of the questions on the Atlas survey, which is how we collect data from facilities, link back to these principles of care. And Atlas then has the ability to sort of show users how facilities kind of are doing in all of these points, and for the facilities themselves. Feel free to jump in with questions at any time. I will pause periodically. So any questions so far? Okay, we'll keep it moving then. So in finding addiction treatment, it's difficult, right? There's a number of challenges with finding appropriate addiction treatment. And from the person with lived experience perspective, coming into, deciding that I needed help, that was all I really knew, right? I didn't know what a level of care was. I had no idea where to start. I didn't know that some programs might take my insurance, some might not. There's all these layers of complexity in finding addiction treatment that's going to suit a person's needs. And that can be really hard to sort through as a person who's probably going through a really challenging time in their life, right? If they're searching for help. If you do jump on something like Google and try to look into addiction treatment, you unfortunately can find misinformation at times, potentially misleading information. What I find in my home state of South Florida is lots of pictures of the beach, which is not incredibly helpful, right? That's not really, actionable information that I can act on. So yeah, it's not always straightforward or easy to find the information on websites, even if I do know what to look for. That can be really overwhelming as a person who's seeking treatment. And it can be hard to find unbiased information. Any providers on this call, I'm sure if you typed your facility into Google right now, it's likely that a few would pop up first because they have, paid advertising in Google and can kind of boost their presence. So it can be hard even if you know exactly the facility you want to go to locate the right website and find the information about that facility. So Atlas really solves for all of these issues. And Atlas, just for your own knowledge, stands for Addiction Treatment Locator Assessment and Standards Platform, which is really a mouthful. There's no quiz on that. Don't feel like you have to memorize it. And there's a number of things that make Atlas really uniquely positioned to be a great resource in the field. Oh, and I'm just going to check on the chat in case that was a question. Oh, okay, just checking in. Thanks, Todd. So, sorry about that. For one, Atlas has a really easy to complete needs assessment. So if you're in a position like I was, where you have no idea where to start, you can answer 10 questions and it will provide a recommendation both for level of care and for ancillary services that might be helpful. So that might include medication-assisted treatment. It might include mental health services. And we worked with ASAM to develop that needs assessment. So we know that that's providing really strong, reliable, recommendations for level of care. Any questions on that assessment? I'll also mention it's written at about a 6th grade reading level and uses as plain language as possible so that anyone can understand that. It's not in clinical language. And it's also not required to take the assessment. If someone wants to, they can search directly for facilities. I talked a little bit already about the standards of quality that we use. Atlas is not funded by providers or pay to play. So if someone goes on Atlas and types in the name of your facility is going to come up. Nothing else is going to come up. No one can kind of boost their presence on Atlas. And it includes a comprehensive list of facilities. So one of the big questions we get from providers is, where do you kind of get this list from? The answer is from the state. So our baseline is to receive a list of facilities, every facility licensed in a state to provide substance use treatment services. From there, we go through a pretty detailed list cleaning process to remove any outdated information, duplicate facilities, correcting contact information, all of those things that anyone who has ever tried to find a resource on the internet has run into, right? Things get outdated and needs all kinds of updates, typos, stuff like that. So we go through a pretty hefty internal process to clean that list. And from there, we reach out to the contacts that were provided to us and ask facilities to submit data via our Atlas survey. And that is the period we are in right now in Wisconsin. So likely you or someone on your team has already received a link to complete an Atlas survey. If not, I'm happy to get you one after this call. You can throw that in the chat. And through that survey is where we get that really rich, detailed information about the services that are offered. For example, whether medication-assisted treatment is offered, how it's offered, what medications are offered. It's very detailed, and so that our users can search based on that criteria. And I will show you that search functionality in just a minute. Another thing that makes Atlas really cool and different is the patient reviews. So just like treatment facilities have a survey they can fill out, patients can also fill out a survey. Theirs is much shorter, it's 10 questions. And again, all of those questions link back to those standards of quality that I've been talking about. They ask things like, did you feel respected when you received services? Did you get an appointment the same day you were asked? And we quality check all of these reviews to make sure that they're not malicious or fraudulent. Sometimes providers have questions around that. Just know that they are all reviewed by a human to make sure that they are real, right? That no one is sort of spamming the system and sending like 10 reviews about the same facility, that it does sound like it was filled out by a patient, not potentially by like a staff member or anything like that. And finally, we offer professional portals. So for any provider that provides data to us, they get their own password protected portal where they can log in and see how their facility sort of measured up on those standards of quality based on other facilities that offer similar services in the area. So I have said a lot, so I'm going to pause again and see if there's any questions on any of that. Okay. And Casey, thank you so much for joining. If you could just drop in what organization you're with in the chat, that would be awesome. So Atlas is currently live in 11 states. We're expanding all the time. In fact, I think there's already more than 5 states that we're expanding to in 2023. But you can see here some of the states that we're in. We're currently finishing up our data collection period in California, which is obviously a really big state for us. And our intention is to be fully nationwide. So I mentioned that Atlas is not funded by providers. Sometimes folks are curious who does fund Atlas. Largely, it's funded by state agencies. I would say most of the time that's the case. Sort of second to that are big nationwide payers. The ones on this slide are some that have funded us in the past, and much less commonly private foundations. That again is not the bulk of our funding, but we have received some funding from private foundations. And I'm going to go ahead and just show you the platform, because for me, that is sort of the best way to kind of get my head around information, is just to go ahead and see it. So I'm going to reshare my screen. So this is treatmentatlas.org. Keep in mind, we're still in data collection for Wisconsin. So Wisconsin is not live on the platform yet. So I'll go ahead and do searches in my home state of Florida. But this is sort of what it looks like. At Shatterproof, we're very interested in continuously improving and making the site more friendly to users. One of our more recent things is you can translate the whole site into Spanish with one click of a button, which is something we're really proud of. We're also in the middle of a website redesign just to make this even more user-friendly, have less text on the page, just, much smoother design. And you can currently use it on a mobile device like a phone or a tablet, but another part of our redesign is making that an even smoother experience, because we know that a lot of folks utilizing Atlas are people working in the field, they're moving around, they're probably not using a desktop computer. All right, just for the sake of showing you, I'll click into the assessment so you can see what it's like. You'll note that right now it's 13 questions, but by the time it goes live in Wisconsin, we'll have whittled it down to 10. Again, always kind of looking to make the site easier to use for folks. All right. So are you taking this assessment for yourself or with someone else in mind? We know that a lot of time family members are the ones searching for treatment rather than the person who's actually going to utilize the services. So we want to account for that in our assessment. What substances are you having problems with? So I'll just note that we use both kind of the more formal name for a substance as well as potential street names, just to be really clear that people know, whether they're choosing the right selection for them. Are you able to just stop using, or do you need to use every day? I'll go ahead and just select that to click through. So we're getting into sort of level of care stuff. This question again is detailing potential symptoms of withdrawal because I selected the drug as heroin or fentanyl. And again, you'll see it's written in what's hopefully really easy to understand language, non-clinical language. Do you have any medical or physical problems right now? So what this is going to do is filter, if I were to say, you know, I have pretty significant physical health problems, it's going to filter for facilities that have physical health care on site, which is one of the...
I may work over here while you do that. Thank you so much.
Yeah. Oh, Mariah, I think you're not on mute. I'm sorry. Our next question is very similar, but with mental health challenges. So again, would filter for facilities with mental health care on site. Are you having any suicidal thoughts that you might be better off dead, wanting to hurt yourself, etc.? I'm going to say no, but note that if I said yes, it would populate resources for suicide prevention. Are you concerned about seeking treatment, thinking about barriers? And any legal requirements. So another data point we collect from facilities is whether they work with folks who are mandated to treatment. So that would filter for that. And then we've just got safe, reliable transportation, a safe place to live, a daily routine, and any issues with mobility, and we're done. So you can see it's recommending outpatient treatment here. If I'm not sure what that means, I can click on this I and it will explain, you know, a little more about that level of care, that it ranges from 1 to 8 hours per week. And the additional services it's recommending are medications for opioid use disorder, withdrawal management, and mental health monitoring. So from here as a user, I could save my results or I could click find treatment now. And that will go ahead and populate a list of facilities in my area that offer all of those things. You'll see them right here that were recommended by the assessment. So I'm going to pause before I dig more into kind of this functionality in the facility pages. Any questions about the assessment?
Not about the assessment, Kelsey, but just real quick, like if I go to your main website, how do I get to this if I was going to search Florida?
Sure. So you would just go to treatmentatlas.org.
Yeah.
And if you want, do you mean you want to just jump to a facility search?
Yeah.
Yep. You could just do that right here and do exactly what I just did. And the only difference will be that it won't have those pre-done filters here because I didn't go through the assessment.
Okay. I think I'm at your main page. All right. I will. Okay. Got it. All right. Thank you.
Oh, of course. Catherine, would you mind dropping the treatmentatlas.org link in the chat just in case folks want to follow along? Yeah.
Perfect.
Yeah, you might have gone in through the Shatterproof website.
I did. Yep, I did. That's right. Perfect. Thank you.
Yeah, no problem. All right. So going back to these filters, you'll see it will always apply quality data provided, which means right now it's only going to show me facilities that completed that survey and provided that detailed information to us. You can remove that filter, and I will show you a facility profile in just a minute for a facility that has not provided that information to us, but there's not going to be a whole lot on the facility page. So these filters are totally customizable, just because the assessment said, you know, I would benefit from mental health care on site. You know, maybe I disagree. I can just X out of them. And you'll see that as I X out of filters, you know, more facilities might come up in the search. And I'll go ahead and show you some of the other search functionality. So from here, I could add filters based on what's important to me. You can search by substance, payment options, private insurance accepted. So this is tailored to Florida, but in Wisconsin, this will be a list of all the private Wisconsin health plans. You can search by treatment type, AKA level of care, facility features, whether there's mental or physical health care on site, not just whether they offer medication for OUD or AUD, but which medication. So some people are specific about what kind of medication they want to be part of their recovery journey. So, I could search specifically for, methadone if I so chose. Other languages spoken, and this is going to depend on the area you're in and what languages are offered by facilities, what drops down here. So in my area, this means at least one facility offers treatment services in each of these languages. Age-specific programming. So, if I'm searching for adolescents, older adults, a certain gender, etc. And we've got special groups served with lots of potential selections here: pregnant, postpartum people, folks with intellectual disabilities, folks experiencing homelessness, involved in the criminal justice system, etc. So lots of ability to kind of customize your search. And if you're a facility that offers, say, treatment for one or more of these special groups, this is a great way to kind of be found by those folks who are looking for that. So I'll pause again. Okay. So I will show you what a facilities page looks like. So when I click in, I'm going to see lots of demographic information up here. And if you're a facility that has not completed the Atlas survey, this is basically what you're going to get, what you see in this dark teal line, because most often this is the information that comes as part of that state list that gets provided to us. But what you would not see is any of this rich information down here. It would just say no data provided. So you can see all of this information correlates back to those filters that I showed you. You can see facility hours. When we scroll down, we can see how this facility measured up sort of on those national principles of care. So this would either be a check or a little X if they indicated, for example, that they don't have coordinated care for mental or physical health. You would see an X here. And in any of these cases, you can click in to see more information. For example, I'm not sure what's meant by additional services to support recovery. So I can see, oh, okay, well, this facility offers assistance with childcare, food, obtaining social services, case management, legal aid, peer support, etc. And I know this is so much information, which is why I keep pausing to see if there's any questions. So I will pause again. Okay. So from here, I could choose to compare up to 3 facilities. So, if I'm trying to make up my mind, I might click add to compare, and I could later look at up to 3 facilities side by side with all of this information, which is helpful. Something that we're looking to do in a future iteration of Atlas is actually have the ability to click through from this facility profile and have some direct linkage with that facility so that they can either set up an intake appointment if that's possible, or just some sort of next step, because that's something that's been brought up as really helpful feedback from different stakeholders in our different states. So I just throw that out there so we are looking into that and thinking around how we could make that part of a future iteration of Atlas. So we very much hope that y'all will coordinate with your staff and submit the survey to us so that we can display all this great information in your facility profile. And I will go ahead and return to my PowerPoint.
Hi, Kelsey. There's a question in the chat from Steve Schultz that says, how would we get access to our provider page?
Oh, great question. So once the site goes live, which is going to happen in June. So our steps are sort of, let me back up. We do our data collection period, which started on January 18th. That's when we send out the survey links to all the providers. We do lots of follow-up to make sure, folks understand how to submit the survey. Once that data collection period closes, We have a portion of time where our data team goes through that information, quality checks it. Providers have an opportunity to preview that information, make sure it looks good to them, etc. When it does go live on the website, which we're looking at end of June, you would just access your page in the same way that any Atlas user could access it, the way I just showed you, by going to treatmentatlas.org and typing in your facility name would be the most direct route to see your facility page. And then I did mention earlier the professional portals. So if you wanted sort of a back-end look, that only you would have access to at the provider, as the provider, it would be to go in through the password protected portal. And then you have the ability to see that same data sort of in comparison with other facilities in the area. Does that make sense? But as far as treatmentatlas.org, anyone can access treatmentatlas.org. There's no username needed. It's intended as a free resource, so we want it to be as widely available as possible. Go ahead, Todd.
Hey, a couple of questions. One is there a phone line that can someone call Atlas as well, or do they always have to go through the website?
Yeah, so that's a great question. We do have a helpline number. I'll say that Atlas is not intended to sort of function as a helpline, but once in a while we get someone who calls and they need a little help navigating the site and finding treatment, and we will help with them. But I sort of caveat that by saying we're not staffed to really promote it in that way, if that makes sense. It's really intended to be used through the website platform, and in that way it's totally anonymous. So that's really our preferred method. Having said that, if someone calls the helpline, they will help them.
So just is your preference then as like, for example, if we have materials that are going out, for example, patients who come into our emergency departments, right? And maybe we're initiating MAT services and you want to give the patient some information now on like, where can they go to access continued treatment? We could easily give them the website. Would we also give them a number, or do you prefer that we just advertise the website?
So great question. We have all kinds of what we call collateral, like resources that we are so happy to mail out anywhere and everywhere that has information on how to access Atlas. In certain states, we have like a state-specific resource card that has not only Atlas information, but other sort of crisis information, how to access naloxone, stuff like that, with exactly that in mind, to provide it to places like hospitals, RCOs, libraries even, and just to go on a resource table or to give out to folks that may just benefit from knowing that a free treatment locator platform exists.
Okay. All right. So based on that, you would rather we hand out those materials as opposed to putting, like if we have some internal documents and guidance to our emergency doctor or to our emergency physicians, you would want us pointing people to the website, not to the helpline number.
Yeah,
Okay,
that would definitely be the best bet.
Yep, sure. Okay, and then second, so like in the list I sent you, okay, so this is technically the state is doing this for all substance abuse DHS 75 certified programs, correct?
So it's for every facility licensed to provide substance use treatment in the state.
Anything with substance abuse, okay.
Mm-hmm.
So you still now, for example, like our hospitals, some are we may be doing detox, but we're not technically, there is no certification for detox. Do you want that kind of information as well?
I think let's touch base about that when we meet, specifically about your facilities, because sure. I think we do have hospitals listed on Atlas that provide detox services, but I think let's wade into the specifics sure. a little more one-on-one just to make sure.
Yeah, we could do that. And then this is probably not going to happen, but just curious, is there, SAMHSA also asks for information and does their survey, which is, I try to avoid it every year and be honest, is this at all aligned with that in any way?
It's very similar information. And in fact, that's one of the things that I'll point out when I talk to folks is, listen, if you have someone who's already submitting this kind of information, they're probably the fastest person to complete it because, you know, they're just, they know how to answer these questions already. So yes, it is similar information that SAMHSA collects.
Okay. They just get a little bit more, I think, into population and service numbers and things. I don't see you doing that.
Yeah, it's a little different in
Okay.
certain ways, but I would say it's maybe more similar than
Okay.
different.
Great.
Yeah.
Thank you.
Yeah. Any other questions? Oh, I see you, Shannon, but I think you're muted. There we go.
Sorry, I have a question as well. I guess I'm curious why Wisconsin is, not that you would know the answer to this, but Wisconsin has 211, which is also a program locator, which is not a very good program locator. I'm just curious why Wisconsin is bringing on another website. Like, why are we gearing them to one versus another? Maybe.
Yeah, I mean, I definitely can't speak for what folks, at whatever level that made the decision to fund Atlas, but I can say that I think Atlas is specialized to substance use, right? So I think there's some advantage there. You saw the cool filtering ability to, kind of go by someone's needs and preferences. We also are painstaking about keeping our information current, which is a real challenge for a lot of resources out there, at least in my experience. Is frustratingly, you spend all this time poring over lists just to realize it's closed or it moved or it doesn't serve the population you thought it was. So all that to say, we really do a lot of work to make sure that the information you're finding there is up to date, accurate, and it's specialized. So I think there's some benefit in that.
Okay, thank you.
Yeah, no, of course. All right, so Atlas is obviously just now coming to Wisconsin, but it launched as a project in 2020, starting in, I believe it was 6 states. And since 2020, it's already been visited 500,000 times. Folks have conducted more than 160,000 searches on Atlas, and facilities have been viewed over 90,000 times. So all that to say is that people are utilizing Atlas to find treatment. And we are conscientious about spreading the word that Atlas is a free resource to the community. And some of the ways that we do that are through billboards, I mentioned earlier, but we do create state-specific resource cards in some cases. I mentioned we have brochures, flyers, one-pagers. I mean, really, you name it. We have all kinds of collateral material that we send to all kinds of community stakeholders to kind of get the word out. So from kind of a pragmatic perspective, Atlas can be a bit of free, advertising for your facility. It's another way that folks can find you and be a referral source. And it's no cost to you. We've also partnered with helplines, warm lines, commercial health plans, drug courts, judges. Really, the list goes on and on. We've partnered with libraries, Oxford houses. Really, if you can think of it, we have probably partnered with them in some way, shape, or form. We like to be really creative about how we get the word out about Atlas as a resource for folks. And yeah, that kind of comes to the end of my presentation here. So any other questions or thoughts, feedback? Did
Nope.
anyone? Oh, go ahead. Go ahead.
No, I just said thank you. Thank you. All good.
Awesome. Anyone have any questions about the survey? Oh, and now I'm seeing a question in the chat. How would we get access to our provider page? Thanks, Steve. So once you submit the survey, I mentioned sort of that process, but I've said a lot of things, so happy to go through it again. We have our data collection period in which you would submit your survey to us. After that, there's a bit of time where our data team quality checks that data and gets it sort of loaded onto the platform. At that point, our data team would reach out to you with the credentials for your password protected provider portal page. And I see your other question, how do you anticipate this being rolled out in Wisconsin? So another great question. We do a number of sort of outreach and promotion activities, which I think is maybe what you're getting at here, but correct me if I'm answering a question you didn't ask. So, we've already begun reaching out to community organizations and of course, we're reaching out to providers, but also sort of non-providers, stakeholders, and entities. We've met with 2 provider associations at this point. We're giving Atlas demonstrations and overviews at provider association meetings and subcommittee meetings, and we'll continue to do so. When the site kicks off, we'll do some of our marketing things that I showed you. We're potentially looking into bus ads, potentially a billboard, doing those state-specific resource cards and getting those out to community stakeholders. So that's just a very high-level overview of how we kind of roll out in a new state. But Steve, if you were kind of getting at something else, please let me know if I sidetracked. Awesome. And just to reiterate, I am your main point of contact. So I am throwing my direct email address into the chat right now. Maybe you think of a question later, or you just want to ask one-on-one, feel free to email me. I don't mind if you call me. I'm really your person. That's what I'm here for. And I really want this kind of a data collection period to go as smoothly as possible. So if you have that survey link and you're unsure about something, don't hesitate to reach out to me. I'm so happy to help. All right. I'll give it just 1 minute to see if there's any other questions, but if not, I'm super happy to give everyone a little time back in their schedule today. Thank you, Shannon. And thank you everyone so much for taking the time to hop onto the provider roundtable. Looking forward to chatting with y'all one-on-one. Have a good one, everybody.